There is now a total of 34 cases of COVID with Omicron variant in New South Wales. 21 cases were locally acquired.
There are fears that a 90s-themed boat party on Sydney Harbour last Friday night may have been a super spreader event.
5 people from this cruise have tested positive to COVID. Preliminary testing, the special test that looks for the S gene dropout on 2 of these people, and they have the Omicron variant.
New South Wales Health is urgently trying to reach 140 of the partygoers who used QR codes to sign in, urging them and their households to immediately get tested, isolate and await further advice.
Only days since this has become an issue for Australia and other countries, and now today we are standing here announcing a new version of Omicron, and it's a first in the world.
In Queensland, where borders are set to reopen Monday, there are 2 cases of Omicron in quarantine. News today that one of them is a new variant of the new variant.
The International Committee now actually reclassifying Omicron into 2 lineages, and we have both of them here in Queensland.
Victoria also confirming its first Omicron case in hotel quarantine. 2 more community cases likely, with more suspected cases under investigation. So as Omicron spreads into the community, do we know enough about its new variant to stay on top of it?
It is likely that the Omicron variant will be more transmissible, but there is emerging evidence that the vaccines are likely to provide clear protection against serious illness, hospitalisation and death. This may well be a milder form of COVID-19.
And Dr Rob Grenfell is the CSIRO's Biosecurity and Health Director. Dr Grenfell, we just heard the Health Minister there saying it seems to be mild. That's been repeated a lot so far. But is it too early to say?
Yeah, I'd have to agree with you there. It's a little bit too early to say that it's a mild disease. What we have seen in South Africa in particular, those who've had Omicron have had mild disease. But again, it takes a while for this disease to develop, and we do need to see what it looks like in other populations that are more applicable to the Australian population.
I don't want to turn you into the Christmas Grinch, but the politicians keep saying no more lockdowns, they're behind us. Do you agree with that, despite all the uncertainty?
Look, lockdown as a tool is there if we cannot control things through other mechanisms. But hey, we're one of the most vaccinated countries on the planet at the moment. And if Omicron is certainly restricted from causing serious disease, as we're predicting, we're in actually a very good position. So we may find that just large scale or at least mass gatherings might be limited, but I don't see a necessity for lockdowns at this stage.
Rob, the world's still scrambling to understand Omicron, and now there could be a second version. Should we be worried?
Well, this virus was always going to mutate. That's how they do this. And so from the original Alpha strain, this one's got around about 88 different mutations on it. And of course, there'll be other variants that are sort of steps in between that, which will appear. At this stage, the 5 mutations on the protein, spike protein, are the ones that are concerning us. And we do need to understand what they actually mean for the volatility of this virus. And after this one, there'll probably be another one, I'm sorry to say.
I know we're all playing easy does it here, but let's say at the end of the rock, paper, scissors game, Omicron beats Delta. Is there a best case scenario for us? Are we in any way prepared for this?
Well, if Omicron is, we know it's more infectious, but if it actually causes less severe disease, that in itself is a better outcome than something that causes worse disease, obviously. But even so, it's a numbers game, because if it's more infectious, it means that more of us are actually going to get it. So we need to actually temper the number of people who are sick, because there will always be those people who will end up severely ill from no matter how mild this infection is. But ultimately, living with COVID means that we and the virus have to come to terms with each other, and it has to get less volatile. And that's generally what happens with pandemic viruses.
When do you think we will get more information and more definitive answers on whether Omicron is best or worst case scenario?
So I guess with the infectivity, that is how infectious it is, we're starting to see that already, the way it's spreading. So it certainly appears that way. And even looking at the start of Delta and comparing that with the start of Omicron, it certainly looks like it's more infectious. The other evidence that'll come pretty soon will be whether or not it actually is beaten by the antibodies generated by vaccines. That's simply doing a test of the serum of people who've been vaccinated and testing that against the virus. So those studies should be coming through in the next week or so. Unfortunately, the severity, that's going to take at least a month or so before we're actually clear on is this more severe or not than Delta.
Such great insight. Thanks for your time, Dr. Rob.
It's been my pleasure.
Sandra, I mean, you're the one with a PhD in epidemiology, worked with the WHO. I'm really curious, I know you'll wait for the data, but are you an optimist or a pessimist about what this new variant means for the pandemic?
No, look, I am an optimist. I think we need to wait to see what actually happens in real life. So the trials that are being done at the moment are called in vitro. It means they're being done in the lab. We'll get those results quite soon, and it will give us an understanding of whether these major changes in the protein structure around the virus, whether that means that it's more dangerous and whether it just spreads faster, as Rob says, and kind of begins to peter out. I think it's really the trials that we start to see in humans, whether the vaccines continue to work, which it's promising early signs, and that will still take a couple of weeks.
They were talking about boosters, Omicron-specific boosters. Is that the way forward?
Yeah, so I suppose it's very similar to what we do with the flu vaccine. Every year we sort of change the formulation slightly to match the new emerging variants. It's very similar to what we're seeing here with this virus. Changes very quickly. And it may be that in the longer term we have to sort of tweak the vaccine each year and provide those boosters periodically. It may not be every year, but it may be, periodic updates.
Gosh,
and in your professional medical opinion, should I attend a 90s-themed boat party this weekend?
Rove, under no circumstances should you ever attend a 90s-themed boat party.
Well,
Virus or otherwise.